This is Selma Schimmel in Chicago at the annual ASCO meeting for the group room, and we're very happy to sit with you, Dr. Clifford Hudis, Chief of the Breast Cancer Medicine Division at Memorial Sloan-Kettering Cancer Center in New York City. Hi, Dr. Hudis.
Hi.
Thanks for being here.
It's a pleasure.
What's happening at ASCO 2012 in the area of breast presentations?
A very important clinical trial that was done with federal money, and I'm emphasizing this because this is the kind of study that's increasingly hard to do in hard times, but turns out to only be doable by the public. And this is a study we did in the Cooperative Group System, which is the National Cancer Institute-funded research organizations that we all try to participate in. In this trial, women with advanced breast cancer getting their first chemotherapy for that advanced cancer were given one of 3 chemotherapy treatments by random assignment. The standard therapy is old now. I remember when it was new, but it's old weekly paclitaxel. The experimental therapies were new drugs, ixabepilone and albumin-bound paclitaxel. And the hypothesis that we set out to test was that each of these drugs would be, on its own, superior to weekly paclitaxel, representing an advance. That's a reason to use them. I think everybody would agree. Unfortunately, our study didn't show that. Our study showed that they were unlikely to ever be superior. It also identifies differences in toxicity that, frankly, largely favor the old drug. So here you have an old and inexpensive drug that is at least as good as the new agents and likely less toxic. And this can represent a substantial savings to the healthcare system in the coming years. And it's a trial that, as I say, requires the public to do because for obvious reasons, commercial interests are less organized towards this kind of a study. And so in an era where we're worried about GDP or percentage of GDP, this is, I think, a really important observation. It doesn't get everybody excited necessarily because we all want to see the ball move further down the field. But what this says is that if we're only getting to the 20-yard line, we can get there a lot less expensively.
Thank you. Dr. Clifford Hudis, Chief Breast Cancer Medicine, Memorial Sloan-Kettering Cancer Center in New York City, and President-elect 2014.
Thank you very much.
Thank you very much.